Hi guys, and welcome to Sugarland Animal Hospital. My name is Dr. Mike. I'd like to let you know a little bit about what happens to your pet when they're about to come to us for hospital or surgery. First of all, we like to prepare your pet the night before. Let's please not feed your pet after 7 o'clock the night before. This ensures that your pet has an empty stomach ready for surgery the next day. We can make sure they have water up until the time of surgery. That keeps them hydrated, but in fact we would prefer them to have an empty stomach. As your pet comes in to see us, we like to make sure that we give them a thorough health check. This is with a qualified veterinary nurse, and we make sure that their needs are well met. Now we'll discuss with you a few things on the day. We'll make sure that they have the options for stitches that may dissolve, and we also like to make sure that you get the option of blood test. Now the reason we do this is to make sure that there's no problems that we can foresee with the anaesthetic. We like to make sure there's no issues with their kidneys, their heart, their liver. Make sure that we can check all their blood parameters, make sure they're not low in their blood cell count. In this way we can ensure a safer anaesthetic experience for your pet and a quicker wake up time. We like to make sure that they have a fear-free and a pain-free experience. We do this by providing special medications to relax them and make sure they're not feeling any pain during their surgery whatsoever. Yes, there's a tiny little bit of paperwork, and just to make sure that you're comfortable with the procedure and that you agree to go ahead. So we'll fill all that out in your pre-anaesthetic consult. Just talking about what happens when your pet goes home, we like to make sure that we send your pet home with adequate pain relief. And this can be up to 3 to 5 days worth of medication, depending on how involved the surgery was. We provide that complimentary to our clients. Also, we like to make sure that you keep your pet still and quiet, hopefully confined for the first few days. This is to ensure that the wound is not disturbed or breaks down. We like you to make sure that you check the wound, make sure that there's no issues with bleeding or swelling, and if there's any concerns, we like to know about them as soon as possible. Feeding your pet, we like to make sure they have a little bit of a feed that night. Sometimes they can be a little seedy from the anaesthetic, so we might start with maybe half a meal and then move on to a full meal if they are feeling okay. So we like to make sure your pet walks out of here full of energy and spirit. We make sure we use the best anaesthetic possible. We're using similar drugs that they use with elderly people to make sure that they have a fear-free and a pain-free experience and practically walk out of the clinic with their tails wagging.